Dr. Sebi, born Alfredo Darrington Bowman on November 26, 1933, gained prominence for his holistic approach to health, emphasizing natural healing through diet and herbal remedies. Dr. Sebi believed that many chronic diseases could be managed or cured by adhering to a diet that eliminated processed foods and incorporated natural plant-based ingredients. Dr. Sebi's approach to health was grounded in the belief that the body has the inherent ability to heal itself if given the right nutrients. His theory was that mucus buildup in the body is the primary cause of most diseases. He emphasized the importance of consuming natural, unprocessed foods and advocated for a diet rich in vegetables, fruits, nuts, and herbs that were aligned with his alkaline philosophy. This meant avoiding processed foods, sugar, and other ingredients that he believed contributed to an acidic environment in the body. His treatment methods included the use of herbal supplements and tonics that he formulated based on traditional herbal remedies. Dr. Sebi created a range of products such as his famous herbal blends, which were designed to support various bodily functions and promote detoxification. He also emphasized the importance of hydration and advocated for the consumption of natural spring water to help cleanse the body of toxins. Dr. Sebi's philosophy extended beyond diet and herbal remedies. He believed in holistic healing, which emphasized not just the physical body, but also the mental and spiritual aspects of health. He encouraged his clients to adopt a lifestyle that fostered overall well-being, including mindfulness practices, exercise, and positive thinking. Dr. Sebi's services garnered a loyal following, particularly within the Black community and among those seeking alternative approaches to health. His methods attracted individuals who were disillusioned with conventional medicine and were looking for natural solutions to chronic health issues. The demand for his services soared, especially as word spread about his purported success in treating conditions such as diabetes, high blood pressure, and other chronic ailments. Dr. Sebi's clinics, notably in Los Angeles and Honduras, became gathering places for individuals seeking guidance on nutrition and natural healing. His teachings resonated with many who felt marginalized by mainstream healthcare systems, providing them with a sense of empowerment over their health. The community he served was characterized by a desire for autonomy, health management, and a holistic understanding of wellness that extended beyond mere symptom management. Numerous testimonials from clients illustrate the impact of Dr. Sebi's approach. Many individuals reported significant improvements in their health and well-being after adopting his dietary recommendations and using his herbal products. Testimonials often highlighted transformations including weight loss, increased energy levels, and relief from chronic pain or discomfort. One client shared that after struggling with high blood pressure and diabetes for years, following Dr. Sebi's regimen allowed her to reduce her medication and significantly improved her overall health. Another individual spoke of how she overcame debilitating fatigue and joint pain by switching to an alkaline diet and incorporating Dr. Sebi's herbal supplements into her routine. Many clients praised Dr. Sebi's holistic approach, emphasizing how it not only improved their physical health, but also enriched their mental and emotional well-being. The sense of community fostered by Dr. Sebi's teachings encouraged individuals to share their journeys, supporting one another in their quest for better health. Dr. Sebi developed a unique regimen, often referred to as Dr. Sebi diet, which includes a list of approved foods, herbs, and supplements aimed at detoxifying the body and restoring health. He founded the Yusuf Village Herbal Healing and Educational Center in La Quibi, Honduras, where he promoted his dietary principles and offered herbal products. His approach attracted a following, especially among those seeking alternatives to conventional medicine, and he became a popular figure within holistic health circles. Despite his popularity, Dr. Sebi's work did not go unchallenged. In 1987, he faced prosecution for the unauthorized practice of medicine in New York. The case arose from allegations that he was claiming to cure various ailments, including AIDS and cancer, without having the appropriate medical licenses. His trial drew significant media attention, highlighting the tension between alternative medicine practitioners and regulatory bodies. Dr. Sebi defended his practices by asserting that he was not a doctor and was not prescribing treatments in the conventional sense. Rather, he was offering natural remedies and dietary advice. His trial ended with a not guilty verdict, largely due to the lack of concrete evidence that he was practicing medicine as defined by the law. Nevertheless, his prosecution underscored the complexity surrounding the practice of alternative medicine and a regulatory framework that governs healthcare providers. The prosecution of Dr. Sebi illuminates broader issues within the healthcare system, particularly regarding occupational licenses and patient autonomy. Occupational licenses limit patients' access to alternative healing methods. Many patients seek alternative treatments for various reasons, including dissatisfaction with conventional medicine, financial constraints, or a desire for more holistic approaches. The case of Dr. Sebi raises questions about the rights of patients to make informed decisions about their health care. Occupational licenses, including medical licenses, not only drive up the cost of services, but also hinder public access to those services, ultimately creating a self-serving system that benefits current practitioners at the expense of the public. Occupational licenses impose barriers to entry for many aspiring service providers in healthcare, plumbing, the law, cosmetology, and the like. Aspiring professionals face extensive training, examination, and fee requirements that can total thousands of dollars before they can legally practice their trade. This not only deters talented individuals from pursuing certain professions, but also restricts the supply of services available to consumers, driving up prices. Patient choice is founded on a principle of self-ownership, which posits that individuals should have the right to make decisions about their own lives, including their health. In healthcare, this principle asserts that patients should be informed participants in their treatment processes. This means not only being aware of available medical options, but also having the freedom to choose among them, be it conventional treatments or alternative therapies. Anarchists call for a free market approach where licenses are determined by consumer choice rather than by government mandates. In a free market, consumers should be empowered to make informed decisions about the professionals they wish to hire. If an herbalist, for example, consistently delivers high-quality service at a reasonable price, customers will naturally gravitate towards them, irrespective of their licensing status. Many alternative therapies such as herbal remedies, acupuncture, and holistic practices have been used for centuries across various cultures. Despite a robust body of research supporting their efficacy, these treatments often struggle to gain FDA approval due to the stringent requirements for clinical trials and the high costs associated with them that conventional medicine has yet to effectively address. Despite the well-known benefits of alternative medicine, governmental barriers prevent the public from accessing these treatments. These include regulatory hurdles, lack of insurance coverage, and societal stigma. Many insurance plans do not cover alternative therapies, leaving patients to bear the full financial burden even after paying for healthcare insurance. The public should have autonomy to choose their treatment plans, even if those choices involve unregulated or alternative practices. Standardized healthcare is often prohibitively expensive, leaving millions without adequate access to the very services purported to ensure their well-being. This situation is not merely a consequence of economic forces or resource constraints. It is a phenomenon that has been in many ways designed and perpetuated by the systems in place. The roots of the high costs associated with standardized healthcare can be traced to several design flaws within these systems. The relationships between healthcare providers, insurance companies, and pharmaceutical manufacturers creates a landscape where prices are inflated due to a lack of transparency and competition. In many cases, the negotiation of prices is shrouded in secrecy, with patients left to navigate a complex web of costs that they cannot fully understand. The lack of clarity can result in exorbitant bills that are out of reach for many families, leading to medical debt or the decision to forego necessary care altogether. Additionally, the prioritization of certain types of care, often surgical interventions, or an over-reliance on toxic drugs over preventative measures further complicates access to standardized healthcare. Preventative care is typically less expensive and more effective in promoting long-term health, yet it frequently receives less funding and attention. This misalignment of priorities can contribute to higher overall costs and a healthcare system that does not adequately serve the needs of the population. In an era where access to information is more widespread than ever, patients should be empowered to explore diverse healthcare options. People are dying because standardized healthcare has a monopoly over medical services. The solution is for us to fight for a free market healthcare system, not to go around shooting CEOs. The narrative surrounding Dr. Sebi's life and work serves as a reminder of why our current healthcare system exists in its current state. The government does not want us to have choices. Like everything else, the government wants to control everything, leaving us to pay for it both financially and with our very lives.